Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We got Kurt here in with us this afternoon, and Kurt was referred in by a friend of his who is a patient of ours, and his dad, right?
Brother.
Brother. Okay, yeah. Knew it was in the family somewhere. Okay, and Kurt's been having lower back pain with right lumbosacral radiculopathy, which is often referred to as sciatica, down his right leg all the way into his big toe, which is specifically the L5 nerve. He's also had numbness and tingling down in his right leg and foot. That's called paresthesia. And he's had some right ankle pain along with that, but he's also getting pain in his mid-thoracic spine here, as well as his neck going out into his arms and shoulders and into his right trap. So I've already done his orthopedic neurological exam. I'll show you a couple highlights of that. Let's have you flex your head forward and backwards for me, Kurt. Okay, so first thing you want to notice is that his head's way forward. His ear's dropping out here in front of his clavicle. It should be back here over his shoulders. That's why his shoulders are starting to round forward a little bit. He's got a lot of tension and stress up here in his upper thoracic spine. His head's also a little forward and translated to the left of center. His pelvis is also closer to the left arm than it is the right arm, so his pelvis is translated left on the x-axis as well. Okay, Kurt, let's sit right here. I'm going to just show him a couple of tests that were positive on you. Okay, this is called a maximum foramina compression test, and that hurt right down there, didn't it?
Yes, sir.
And then we're going to go backwards and left and down, and that one probably hurt the same area right over here, didn't it?
A little bit.
Yeah, not as bad as the other side though, right?
Correct.
Now when I do this, that felt better?
Yes.
Okay, that's a decompression test, and I want to check his muscle strength. He had good 5x5 strength up here in his delts, and in his biceps and his triceps, so I'm not going to do those over again. I checked his reflexes, they're +2 equal and active. Let's go on, you tell me for me again, Kurt. I don't want to do those tests over too much. His right leg's short by about 1/2 inch. So lock your right leg straight, lift your whole right leg off the table. Okay, relax that one. Now do the same thing with the left one. Yeah, the left one's harder, wasn't it?
Yes.
Yep. So that means he's got a left sacral deviation, he's got a right SI joint subluxation, because his right leg's short here, but when I bring it up, it actually gets 1/2 inch longer, and that tightens up in your low back and your quads, doesn't it?
Yes.
Okay, so I'm going to start off by adjusting his lumbosacral spine and sacroiliac joints in his low back and pelvis. Kurt's already been to other chiropractors before and been adjusted, where they put him on his side and twisted him. Side posture adjusting, which I don't do very often. There's occasional times that I do it, but I don't do it very often. I usually do P to A work and decompression on the lumbosacral spine and SI joints. There you go. Boy. Yep. You're gonna make a lot of people happy today. Alright. Including yourself. There we go. And get your upper thoracic here. Now let's turn on your back for me, please, sir. There we go. Okay, so remember your head was forward? So what I'm going to do is I'm going to bring it up and backwards to restore your cervical curve, like this. Good. Okay, now slide down about 1 inch. And let's put both arms straight out to the sides, palms facing up. There you go. Adjust your shoulders, your clavicles up here, and then your interior ribs right here as well. There we go. Good. Okay, now just relax your hands on your tummy. Let me have your leg here. Just let this go limp. There you go. Now you should have felt that from your knee all the way up into your hips and back.
Yep.
Okay, same thing here. Breathe normal and relax your leg. There you go. Good job. Okay, let's go back on your tummy for a second. I want to do a test over. Your right leg was a half an inch shorter. It's exactly even now, and it stays even. Does that tighten up as bad as the first one?
No, it does not.
Excellent. Good. Let me do this one too. Go ahead and raise your right leg up. That probably even felt easier than the first one.
It did. It's still tight. But
Yep.
Yeah.
Now the left one. Now that was a lot easier on this side.
Easier.
Yep. Okay, let's come over here on this table next. So see, those are objective methods to see whether an adjustment was an effective adjustment for a specific condition. And if you do pre and post testing on patients, go ahead and slide up a little bit for me, Kurt. You want your pelvis right under that pin. Justin, if you're watching this, we're still waiting on the pins and the plans. Let your legs bend and relax naturally, Kurt. This is how I recommend you start sleeping on your back with your legs elevated.
Okay.
Get you a clothes basket and put a pillow on it and duct tape the pillow to the clothes basket and hold your legs up parallel with the floor. You should feel that relaxes your lumbar spine more.
Yeah, it does.
Good. Okay, so I want you just to keep your teeth together. Breathe through your nose. Oh yeah. Yeah. That's why we call it ring dinger.
Good Lord.
Yep. You see, you're still kicking though. That's good. You felt that all the way down, didn't you?
Oh yeah.
Okay, keep breathing though. And let me have your neck. Okay. I got you over here. Drop it in my hand. That's better. Much smoother on the right side. Keep breathing. Breathe in through your nose, out through your mouth. Well, you did good. You didn't even cry on your first visit. Stand in front of the mirror.
Can't cry in front of the camera.
All right. Now, let's have you flex your head forward and backwards again. That should have felt a little smoother already.
It did.
Okay, so your head's still forward though, so we're going to pull your shoulders up and back. Flare these guys like this. See how that tightens that whole trap up? And then we want to bring your head straight back in the Z-axis. And then now look at the wall behind you. You might want to spread your feet a little further apart so you can stand up. There you go. You're going to feel a little tap there. There, now relax again. And try that same thing again, and this should feel even smoother to you this time.
Yeah, it does.
Yep, take a look in the mirror right now here at the spacing. Look how much more that's evened out now.
Right.
And see how your head's up and back over your shoulders more now. Your shoulders are more squared off. Your hands are at your sides as opposed to being out in front of you. So, everybody always wants to know how the very first adjustment here at Advanced Chiropractic Relief was.
I gotta say, it's a lot better than the other chiropractors I've been to. The doctor is very knowledgeable, and I feel better than when I walked in here. So
There you go.
It's A+ all the way around.
Well, thank you very much for sharing your experience with everyone.
Appreciate it.
You bet. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, and we'll see y'all soon.